What if an improperly diagnosed X-ray report led to you having chronic pain and suffering for the rest of your life? This episode, I'm going to show you guys the 7 last X-ray reports that I got, and I'm going to show you how I analyze them and read them, and I'm going to show you why, unfortunately, almost every radiologist don't read X-rays properly. Now, neuroradiologists will, but I want to show you why the problem is causing patients to suffer even more. So you want to go to an expert who knows how to read these. So let's dive in. Let's take a look at these statistics here. Medical treatment for chronic low back pain costs practice members or patients $9,000 to $19,000 annually a year. Pain and suffering from severe pain, when left untreated, causes $7,726 more on healthcare expenditures per year. So look, what does that mean? That means a lot of money is spent in unnecessary procedures that don't even get the patient better. So let's look at some of the X-rays to substantiate where are all these findings coming from and where is all this medical research talking about. As an expert in fixing and actually correcting the spine, returning it back to normal position, I know firsthand when I'm looking at images and X-rays, I want to see that the spine is healthy and normal from all angles and all positions, and that it moves properly through its full ranges of motion like a normal joint should, and it doesn't have any restrictions, because restrictions in movement means restrictions in quality of life. So I'm going to show you exactly how I see that on the X-rays and measure it. So here we have an example where the radiologist said that there's no dislocation or fracture. That's okay, that's normal. Mineralization and remarkable alignment appears normal. Disc space heights are normal in height. Now here's the problem with that. This X-ray right here shows this is a straight spine. There's no curve in there, and it actually starts to reverse. So that is a reversed angulation. Mineralization is unremarkable, which I do agree with. Alignment appears normal. Disc spaces are normal. No rotational instability. Now here's the problem with that. This person's supposed to be flexing forward. They actually labeled it wrong. This is an extension film. That spine is completely straight. There's no curve whatsoever. All they would have to do is measure that, which we did. Here is the film. Only 28 degrees, and the curve starts to go in the wrong direction. If this was even in a healthy curve position, this should be closer to 40 degrees in the lumbar spine, closer to. And there's some posterior translation. Now, what's the problem with that? If we take a look at these other films, we see no movement in the spine. How do I know that? I don't see a nice healthy curve as they flex forward. Almost, if you can see here, this looks completely straight, completely straight. There's almost no bending movements in the spine. So what's that going to do to this woman's spine? Well, if we look at the literature, the literature shows that if you lose the lumbar curve and you start to have a lot of compression, that's going to lead to chronic pain and disability. That's exactly what's going on here. So the radiologist read isn't helpful whatsoever, because this patient needs to know that they have no curve in their spine. So that's going to cause a lot of dysfunction and disability as they age. So what do they need to do? They need to fix it. But let's look at some other X-rays to see if this pattern is normal with radiology reads. So this film really hits home for me. This is actually the same patient, and this is the cervical spine. This is the neck view of this patient. This one says loss of normal cervical lordosis. That's not a loss of normal cervical lordosis. Technically, it falls into that category, but it's actually worse. That spine should be all the way back here where the neck fold is. What we have here is actually kyphosis. It's the wrong direction. Straight up and down would be right here. This is actually going the wrong direction, and there's actually multiple curves in the spine, which is evidence of whiplash, typically. Whiplash type forces into the spine. No evidence of instability on flexion view or extension views. Now here's the problem. They didn't measure that. I can tell you why. When this spine gets bent forward, let's look at this right here. If we measure this, you're going to see right here, that's 3.4. That's actually unstable. And if they measure this one, that's 3.62 millimeters. So actually, these are unstable. These are technically and by definition unstable. Instability is right there what you're looking at, and these weren't measured, but it's also very easy to see that that's very unhealthy. So at least they should say ligament lax in here, but I don't expect to see that from reports. If we move on to the other film where the patient looks backwards, you can see here they're getting almost no movement. The only movement is occurring at the upper portion of the spine. This whole thing should be back, which means that's not moving normally, which means it's going to degenerate faster. You get rapid degeneration of the spine. And what does that mean health-wise? Thyroid's up here, brainstem's right here, immune function, thyroid dysfunction, sleeping and wake cycle. All of these things the patient is actually having. And it gets worse. Let's see what some of the other films look like to see if this is a recurrent theme. Guys, I went ahead and took the liberty to draw on this one so that we can speed this process up a little bit. This patient, unfortunately, is suffering a lot health-wise. Immune function, allergies, rather hay fever, sinuses, not sleeping very well. Does have neck pain, but that wasn't the primary reason she came in. Issues with the thyroid. Did I mention that yet? This patient, it says there is normal straightening of the cervical lordosis. That's not straight, guys. That is kyphotic. It's going in the wrong direction. Very wrong direction. This person is extremely young. Less than 30, mid-20s, early 20s. Disc spaces are normal in height, no evidence of dynamic instability. Well, guys, what did you just see? By this point, you guys should probably have a good idea of what we're looking for. This neck isn't moving at all. Only up here, do you see any change in the curve right here? Completely stuck. We've got to get this adjusted, get these joints to start moving properly so that when she bends her head back, everything moves with her and she gets good health and function, vitality, good nerve flow back up into her brain. We look at the flexion film, and by the way, there is ligament instability right here. I just didn't measure it. I measured it here. When she flexes her neck forward, how bad does that look? That should be a nice curve forward like this, not jutting back. That means extremely poor biomechanics, arthrokinematics of the neck. That causes a lot of issues, guys. Rapid degeneration, things you just don't want to have. Brainstem's right here. Immune function, sinus, allergies, headaches, migraines, especially what she's dealing with. 2.5 millimeters, guys, that's not technically instability or surgical yet. 3.5 millimeters is. But many of my colleagues, because we're the ones who deal with this every day and treat this, we're the ones who actually see the x-rays and measure the lines. We know what the clinical symptomatology is and how patients present. When they have even a little bit over 2 millimeters, that's really bad. 1.75, that's pretty much 2 millimeters. 2.5. In multiple areas of her neck, something happened, guys. This patient needs to get to a good provider like myself, like other physicians trained to structurally fix the spine. If you guys are out there and you guys need help, let us know. Let me know. Send a message, ask for some help, get on a discovery call. Let's see how we can put together a blueprint, a program to help you guys fix this right away. Talk to you soon.